Visual skills, definitions, and testing. By the end of this presentation, you should be able to identify the 6 extraocular muscles for each eye, identify and assess the 4 basic visual skills, and identify possible functional implications when eye movements are not coordinated, smooth, or efficient. Use of vision for everyday tasks requires more than visual acuity and visual fields. The eye's ability to move together and in a coordinated and efficient way is critical for functional use of vision. Take a look at this illustration of people at the beach from the book, Where's Waldo? Think about the process required to complete this task and find Waldo. How important is the ability to detect fine details or visual acuity? What portion of the brain is being used to recognize and label the various individual images? Is it important to first know what Waldo looks like? What happens if you don't have a particular image in your visual library? What would happen if you could not move your eyes in an organized way across the page, or if you could not manage all of the visual information presented simultaneously? The ability to move your eyes in all positions in a smooth and coordinated way is dependent on the extraocular muscles surrounding each eye and the brain's ability to communicate with the muscles via the third cranial nerve. The 6 muscles originate deep within the socket and extend to the sides of the eye, attaching to the sclera. These muscles are innervated by 3 nerves: the oculomotor or third cranial nerve, the trochlear nerve, and the abducens nerve. The lateral rectus muscle moves the eye towards the side of the head or away from midline. The medial rectus muscle moves towards the nose or towards the midline. Superior rectus moves the eye upward. Inferior rectus moves the eye downward. The inferior oblique muscle moves the eye upward and laterally. And the superior oblique muscle rotates the eye downward and laterally. One component of a routine eye exam is called EOMs, or extraocular eye movements, or sometimes called ocular motility. The doctor is evaluating the coordinated movement ability of the ocular muscles and the health of the visual system. The results are often noted as the ability to fixate and follow, and are described as smooth, accurate, full, and extensive. Ocular motility is the ability of the eyes to move together in all positions. This ability enables a person to keep an image on the macula, or we call this fixation, and to quickly jump from one object to another, we call this saccades, and to track moving objects efficiently, or sometimes called pursuits. Ocular motilities, or extraocular eye movements, are terms commonly used by eye doctors. Educators use slightly different terms, yet mean the same things. Fixation, shifting attention, or saccades, tracking, or pursuits, and scanning, to look over quickly and systematically, tracing, following a visual line. When the eyes do not move together, or visual skills are poor, a person can have a lack of visual efficiency. Let's try these out. You may want to pause the presentation while you try each of these exercises. Hold your finger or another target straight out in front at eye level and at arm's length. With both eyes open, look at the object. Your ability to hold your eyes when looking at an object is fixation. If you can keep your eyes on the target, you are able to maintain fixation. What are some situations where the ability to maintain fixation is important? How is the ability to maintain direct eye contact perceived in social situations? Saccades are quick eye movements that shift the point of fixation or attention. Small saccadic movements between letters, words, or lines of print are used for reading. Larger movements are used when looking around a room. Saccadic fixations may also be called shifting attention. To make a lateral saccade, first fixate on the hand to the right of the screen. Now look quickly at the hand on the left of the screen. Because saccades are so very fast, it may be difficult to see the eye movements as discrete jumps. When a student copies their spelling words from the chalkboard to a piece of paper on their desk, they are using saccades, or shifting their visual attention. Can you think of some other examples? Pursuits is a clinical term for the ability to visually track or follow an object. These are slower, accurate, and more controlled movements than saccades, and keep the image or object on the macula and fovea. Look at your forefinger at arm's length, and then move your arm left and right while fixating your fingertip. If someone could not visually track smoothly or loses their ability to fixate on a moving object, what tasks or activities would they find difficult? Smooth, accurate eye movements are very important when it comes to paying attention, copying from the chalkboard or book, reading efficiently, and doing well in sports. Problems in this area can lead to all sorts of problems in school if they are not detected early. Formal evaluation of motilities or extraocular eye movements occurs as a part of the clinical examination. Often the doctor will ask the person to look at a light, called a transilluminator, or their finger. They may ask the person to keep their head still and try to only move their eyes. This demonstrates if a person can control only the eye movements, or if they must use a combination of eye and whole head movements together. In addition, the examiner is monitoring for fixation and eye alignment. Once the person locates and fixates on the target presented directly in front at eye level, we call this the primary position, the doctor moves it in a particular pattern that requires the person to move their eyes in all 9 positions of gaze. There are different patterns or ways to move the target. The eye movements are noted using the following descriptors: smooth, accurate, full, and if the eyes do not remain in alignment or do not move together, this is also described. Watch this video of a young boy being evaluated as a part of a clinical exam. The examiner is using an interesting and age-appropriate image on the end of a flat wooden stick. Notice how the doctor moves the target and observes the boy's ability to fixate and follow or track the target. Are his eye movements coordinated and smooth? Can he keep his head still, or does he need to use a combination of eye and head movement to complete this task?
No, that was all vertical. So some of it was 25 was done without, with the glass on. And
Just
then
keep following it.
near is
Oh, so cool. Let's do it with your glasses
with
off now,
glasses,
okay?
14 without. That's just horizontal. That's just an alternating to measure vertical. That you could put with DVD.
Good. Good job. Let's go up. Down. Look right at it. Awesome job. Thanks.
What did you notice? He was able to keep his head still and move only his eyes. He could fixate, but had some difficulty and briefly lost fixation a couple of times. He had difficulty following or tracking, especially in down gaze or when looking down. His eyes did not remain aligned when looking right and left. His right and left eye did not move outward. Remember that unless conducted by a skilled eye doctor, a diagnosis cannot be made. However, observation as a part of the functional vision assessment can be documented. If anything appears unusual, then a referral to the eye doctor along with the FVA report should be made. Here are some tips for evaluating eye movements. First, use a target that is age appropriate and is motivating. Keep both eyes open and encourage them to keep their heads still. First, present the target directly in front of them at eye level, or in that primary position. Make sure they can visually locate or fixate on the target. Then slowly move the target in all positions of gaze. In the text, Looking to Learn, it talks about the importance of designing a visual skills program for those students who exhibit deficiencies, with the goal being to increase visual functioning. Dr. Ann Korn tells us there are 3 different approaches applied in visual skills training. Vision stimulation. Some children need to be motivated to use their vision. Care must be taken to present visually interesting objects that may have an auditory component, yet are not overly stimulating. This approach is commonly used with very young children with severe vision loss. It is also important to keep the goal of increasing visual functioning with meaningful tasks in mind when using this approach. In other words, providing vision stimulation should never be the end goal. Visual efficiency. First introduced by Natalie Barriga in the early 1970s, this teaches a person to use their vision more effectively. Here, the person might learn how to interpret a blurred image using contextual cues, or learn a more efficient scanning pattern. The goal is to be able to transfer these skills to meaningful tasks. Visual utilization. Here, the environment is modified to increase visual function. In the last module for this course, we will be discussing various methods, various optical devices and non-optical modifications to perform a visual task. Unlike assessment of eye movements in a formal clinical setting, assessment of visual skills functionally include the following. General eye alignment. Remember that you are only observing here and not making a diagnosis. Fixation ability. Saccades, or the ability to shift visual attention. Can the person track or follow a moving object? And does the person visually scan or search for an object? Assessment of fixation ability can be observed in isolation, like in this photograph of a young woman sitting in a chair. Or it can be observed while the person is performing other activities. In either setting, look for the ability to maintain fixation. Are the eyes steady and aligned? Can they maintain fixation for several seconds, or do they briefly look and then look away? What is their head position? Sometimes people adopt a particular head or eye position in order to maintain fixation on an object. One example is the person with an nystagmus who uses a null point, or a person with macular degeneration and uses an eccentric fixation point. Can they establish and maintain fixation in all of the 9 positions of gaze, or is one position easier than another? This can help determine where to first present information. Shifting attention is the ability to accurately make saccadic jumps with their eyes from one point to another. This can be in various positions like left to right, up to down, as well as near to far. In this photo, you see a teacher sitting on the floor with the young student, and she is holding up 2 familiar photographs to the left and right of the student. Keep in mind that the goal is to determine how well a person is able to move their eyes in a coordinated and efficient way, and is not testing visual acuities. Make sure to use objects that are easily located and motivating. What are the functional implications of the ability to accurately and efficiently shift visual attention? We use this skill all the time throughout the day, but one of the most common examples is observing and copying what is written on a smartboard or chalkboard in the classroom. You may be doing this right now if you are watching this presentation and making notes. Another common example is while driving. Watching objects on the road ahead or in the rearview mirrors and then checking the speedometer or other controls requires large, quick, and accurate saccadic fixations. Visual tracing is the ability to follow a visual line. People trace horizontally, vertically, and diagonally. Instruction should go from simple to complex. An example of how the skill of visual tracing might be applied is demonstrated in these photos. The one on the left shows how a person might trace the visual line created by the sidewalk and green hedge to locate the street pole, and then trace the pole vertically to find the street sign. On the right, tracing the edge of the sidewalk and up the stairs is used to locate the front door and number of this house. What might be some other examples of using tracing to locate a desired object or location? Visual tracking means following a moving target. The clinical term is pursuits or following. A person should be able to first fixate, then follow or track an object or target when moved horizontally, vertically, and diagonally. A person who has difficulty maintaining fixation may experience greater difficulty tracking, especially if the target is moving quickly. Tracking a ball, visually following animals, like in the photo of a mother duck and ducklings, or visually following the movements of a teacher are just some examples. There are many more examples of how eyes are used to visually track moving objects to accomplish functional tasks. Can you think of other situations that visual tracking is used? What might be the consequences if someone had difficulty with this visual skill? Can you think of some modifications that might help? Efficient visual scanning is the highest level of visual skill, as it requires the person to use a specific pattern of eye movement without the visual support of fixating and following an object to gather information efficiently. When assessing, look for efficient scanning patterns, horizontally, from left to right, up and down, and near to far. If needing to locate an object positioned vertically like a pole, a horizontal pattern is best. Conversely, if the object is placed horizontally, a vertical scanning pattern is most efficient. Scanning is used to search an area for information or for a specific object. Think about when you are looking for that cell phone or when you have dropped an object. The efficiency of the search pattern used will impact the ability to gather information or locate an object quickly. Successful visual search is affected by, first, knowledge of the desired object. Does the person know how to identify the object? A complex environment may be distracting, or objects may blend into a visually complex background. Think about finding a small object on a highly patterned rug. Is the object too small to be detected visually? If a person has a reduced visual acuity and cannot resolve details, visually locating an object may be difficult. And a severe peripheral visual field loss can make visual skills more difficult. It may be difficult for them to know how much to move their eyes to efficiently scan an area, or they may not use an efficient pattern. In a functional vision assessment, formal, informal, or both methods to observe scanning may be used. An informal approach presents a particular visual task that requires them to use large eye movements so that the examiner can observe whether they use a whole head movement and visually scan. One example is to place objects on the table or floor or wall and ask the person to collect the objects. Then watch how they move their eyes and the pattern they use to collect the object. Is their pattern of scanning systematic or random? Are their eye movements smooth, accurate, and full? Sometimes you can also observe the accuracy of their eye-hand coordination. Watch this video about assessment of ocular motor skills by the Child Development Institute from the University of North Carolina, Chapel Hill.
Right now we're going to assess the oculomotor skills of Aisha's vision, and the first thing we're going to look at is her fixation. And by doing that, we're just going to let her play with toys to see if she fixates on the toy. Both eyes aligned, the head and the neck are straight, and there's no head tilt. Right now she's playing with them.
From the time you meet the child, you are assessing ocular motor skills through observation. What you see the instructors doing with Jessie and Aisha is a more formalized way of yielding this information. While it is formalized, notice that the instructors are using age and developmentally appropriate materials and approaches to elicit responses.
What kind of animal is that?
A zebra.
Prior to this activity, Shanna had already noticed informally that Jessie tracked a ball as it was thrown toward him and tracked people as they moved across the room. Thus, the formal activities are a confirmation of what has been observed informally.
Here's another example of a functional assessment of the visual skills, fixation, and scanning. In this video, watch this young girl select large colored beads spread out on the table in front of her. Try to observe her ability to fixate and the scanning pattern she's using. At the same time, you might also notice her eye alignments. Pause this presentation if needed and write your observations.
And any more? Are there any more red ones? Look carefully. I see one. I spy a red one. All right, I'll help you out. Right there. What color you want to put on next? What would? Purple? Okay. But we have to find all the purple ones. Good looking. Oh, I spilled it again. Okay. Good. Initially she needed to have her other hand there, and now she's not using it. Just not much. What color now? Orange, did you say? Oh, okay. How many orange ones do you see? Okay, let's pick them up. Okay, got it. That's one.
What did you observe? Compare your list with this one. She was able to fixate on the beads while searching and when threading the beads on the string. She demonstrated the ability to scan horizontally and appeared to start in the center and left before looking to the right. This would need additional observation to determine if this is a consistent behavior. She used a combination of head and eye movements to scan. This also needs more observation to determine if she is able to move her eyes in all positions without moving her head, or if she needs to use a whole head movement, especially when looking to the right. Her eyes did not appear to be aligned, with the left eye turning inward. It is important to first see if this was noted in previous eye reports, and refer to an eye doctor for further evaluation. Could this be why she did not scan to the right first? In this last video, watch this teacher and her student who is deafblind during a writing lesson. What visual skills is he using during this lesson?
Number 3, ball. Number J.
I think it's better to erase than cross off.
Ball.
Okay, can you read this? Today is Tuesday.
You want to pass me the ball?
U E good S D A Hi. Good spelling, Tuesday. Nice. Okay, let's read this one. I had shopping. That's right. Where is the word shopping? Oh, you gonna put it down there? It's better.
What is it? It's
And G. Okay. That's the same. Very nice. think so. I don't know. No. Who was sleeping? The sun, yeah. Because he's tired. Is that Win? You? Is it Win? Ah, you are tired. Sleeping while the sun's out in the day? Yes? You need a nap. The moon, right. And the sun, and you're sleeping because you're tired. Nice signing. Is that your clock? Your alarm clock? Wow.
Wait, are we ready? What should we tell Mom today?
Is that the noise? And then you wake up? You were sleeping and you were tired? And then the alarm? Did it go off at 6 or 5? Which? 6. 6:37.
Compare your list of visual skills with these. Fixation. He was able to fixate on the page, his pencil, and the teacher. He could shift his attention vertically from his teacher to the front to his paper. He could also shift his attention horizontally from the paper in front of him to the paper on his right. He could visually track the tip of the pencil when forming the letters and when drawing. And he could visually trace or follow the line of the print words supported by his finger. While this observation yielded some good information, more time is needed with other tasks and the ability to watch his eyes. Being careful not to attempt to diagnose, what are some ways to document and describe visual skills? Here are some examples. Sharon demonstrated the ability to maintain fixation on motivating objects at various distances. Sharon demonstrated the ability to horizontally and vertically track a quickly moving 2-inch target, but with jerky fixation. Sharon could efficiently scan at both distance and near distances using a left-to-right pattern. And she could accurately shift visual attention horizontally and vertically. When selecting items for use for assessing visual skills, or to include in a functional vision assessment kit, it is critical to use materials that are age appropriate. Also think about what behaviors or activities would enable you to observe visual skills. Gathering and sorting activities can be functional and fun, but also can help you know where they are looking, especially if it is difficult to see their eyes. Functional vision assessment kits must be portable, and so materials should have multiple uses. Large beads, counting bears, or the large squares used for color screening can be used to assess visual skills too. Consider using real objects in functional tasks from the classroom or home, like sorting silverware or organizing CDs. Having a box or storage container for objects in the FVA kit will help keep things organized and quickly located. Now let's go back to Where's Waldo? By now, you should have realized that visual acuity and being able to identify Waldo, which is familiarity and ventral stream brain function, is important for this task. But visual skills are equally as important. The ability to manage the complexity of the images on this page is crucial. If the visual and sensory processing systems in the brain are overstimulated, then visual attention is affected. Other critical skills include the ability to fixate on the images and scan in an efficient pattern left to right and up to down in order to find Waldo quickly. Did you find Waldo? If not, here's a little help. Let's review. Clinical testing for fixation and following a moving object seeks to evaluate eye muscle movement and control. Fixating and following or extraocular muscle movements in a clinic do not always indicate functional use. Visual skills are key to the ability to functional use of vision, and visual skills must be efficient. This completes the visual skills presentation.